Episode 2, my friend.
Episode 2.
We're back.
How you doing?
Doing good today, man. Doing good today. By the way, we're on our lunch right now. We do these episodes during lunch because we work a full-time job downstairs.
8 hours a day?
Yeah.
8 hours a day.
So we're currently have we discussed where we work actually? Have we disclosed?
I don't think
I think we just went over like our
the
credentials.
basics, yeah. So we work at an outpatient neuro-orthopedic facility in Biloxi, Mississippi. Well, D'Iberville, Mississippi. It's called Neolife Physical Therapy and Wellness. There's 4 locations: D'Iberville, Bay St. Louis, Gulfport, and Ocean Springs. But me and Austin are at the D'Iberville location.
This is like the main building. This is a state-of-the-art facility. We have sports performance. We have aquatic therapy. We have multiple therapists, multiple staff. Podcast studio up here. I don't know if another PT clinic has a podcast studio.
Me neither.
Do you know, Jeff?
Me neither.
By the way, if there are any other pickleball podcasters out there, reach out to us. We'd love to connect with you.
Yeah, man.
We'd love to sit down and chat about
have a conversation.
Similar interests, similar ventures. So any other pickleball podcasters out there, let's connect. That'd be great.
Yeah. Yeah.
So Jeff, let's talk about this situation. The other day, we were working a pickleball event. It was the Sacred Heart tournament in Pops Ferry in D'Iberville. And we had a patient come and give us a little spill about some tennis elbow he was dealing with.
Yeah, so he had lateral epicondylitis, and I thought the most interesting about that, he kind of gave us sort of the synopsis of everything he was doing, which he wasn't wrong with everything that he was doing. But you mentioned rotator cuff, right? And so I thought that was pretty interesting because I had never really thought about looking at and addressing the rotator cuff with lateral epicondylitis, but I would assume that would create like a abnormal load distribution throughout the upper extremity. So can you kind of explain a little bit?
100%. Let's just go over for the general viewer about what a tennis elbow is. A tennis elbow, and I'm sure a lot of you pickleball players have dealt with some degree of overuse in this elbow tendon right here. Essentially, all of our common extensor tendons that come onto this elbow right here can become inflamed and degenerate over time. So you have this spectrum of, we call it tendinopathy is the new term. We don't like to use the term tendinitis anymore. Do you agree, Jeff?
Past the acute stage, it's no longer an itis, really. We learned it in school as tendinosis, anything past that. But, tendinopathy, that's typically what I say.
Tendinopathy is the broad term we use to identify tendon dysfunction. And this patient came up to me and he's like, I've just tried the conventional wrist curls and everything. It got a little better sometimes, but it would just eventually just plateau and get back to where it was. And I'd ask him about hey, have you ever tried to strengthen your rotator cuff? And he's like, no, why would I want to strengthen my rotator cuff to help my elbow? Well, if you think about it, if you only isolate one part of your upper extremity and only focus on your symptomatic area, you're never going to get the results you want to because you have to strengthen the whole chain. So if you're just isolating your elbow extensors in hopes to, help lay down healthier tissue, follow the generalized, eccentric loading of your tendons to try to target your extensor carpi radialis brevis, that's great stuff. Great stuff.
It's not wrong because tendons love load; they heal under load,
100%.
right? So it's not wrong,
but our school of thought is if you have a kink in the hose and there is some sort of strength deficit in your rotator cuff and you're swinging your paddle, forehand, backhand, serve, whatever that might be, where's all that distribution of force going to go to? Down or up? So if you have a weak rotator cuff, what tends to happen is that force, there's a phenomenon called tension hunting that happens. If you can't accept, modulate, and distribute load from your rotator cuff, that's going to extrapolate down to your common extensor tendon and even potentially down into your hand. So people who have tennis elbow or have tried conventional therapy and failed, they never strengthen the rotator cuff. And and the scapula stabilizers. And that's a huge thing that I've noticed with my patients, and I'm sure you've had success as well. You're familiar with this, is that when you strengthen the unit as a whole, things are always going to get better more efficiently. Because my pet peeve is when a patient comes in for a referral, and they're like, oh, my shoulder hurts, but I've got to get another referral for my neck. They're connected.
They're connected.
You can't treat one without the other.
Yes.
So why would one just want to isolate and treat a singular unit when we have to treat the whole system as a whole? So I'll harp on that to the day I die. You will never get the most optimal rehab if you just focus on.
No, that makes sense. Like in regards to a lot of like low back dysfunction that I see, a lot of times the low back feels the need to create more space and move a little bit more due to restrictions in the hip joint, right? So as we usually tell patients, I've heard you tell patients this before too, right? Your ankle's supposed to be mobile, knee's supposed to be stable, hip's supposed to be mobile, and your lumbar spine's supposed to be stable. However, if there's a kink in the hose, as you would say, right, that can create issues either up the chain or down the chain. So that makes complete sense. Like I thought about it a little bit more, but I just never thought about rotator cuff.
You're 100%
or tennis
right.
elbow.
And I'm going to expand on that when it comes to stability versus mobility. When we're talking in terms of stability versus mobility, each joint has more of a bias towards mobility. Example, the shoulder has an immense capacity to be mobile, right? And then on the other side of the spectrum, like our hip is more designed to be stable. Low back, I don't think I really agree with that statement. I think a combination of mobility and stability is required to be an efficient organism, an efficient athlete. Because if you're just only stretching and not stabilizing, you're probably going to set yourself up for failure. So the analogy, I think you've heard me say this with patients too, is with the spine. They're like, oh, I shouldn't be moving my spine very much. That's going to be bad for my discs, right? What do you think about that when they say, doctor told me not to bend down and pick stuff up because I'm bending my back? What is your opinion on that?
There's a way to go about it, the appropriate way, like hinging, right? But at the end of the day, too, if you are not moving and giving your joints, your facet joints, a stimulus to adapt and get better, it's not going to feel the need to. So if I want to go to the gym and get stronger and I lift light weights the whole time, I'm not telling my muscles to adapt to anything. So they're 100%. Not going to get stronger. So I would assume that that's kind of how you feel about the 100%. Spine as well. Yeah.
The analogy I love to give my patients is do you want your spine to be a twig that bends and snaps really easily? Or do you want it to be like a metal rod that bends and is malleable? It's long and strong. I like to use that word, and I feel like Movement Doc would love this one. Long and strong, because you want to be able to express full length of your tissues with control and with efficiency. So that one's for Movement Doc right there. Nice. Long and strong.
That one's for you.
Yeah.
That one's for you, Robbie.
For sure. But let's talk about recovery, man. Right?
Yeah.
Because when it comes to pickleball, if we want to make sure that we're performing at our best, we gotta recover.
Yeah. And I know, you have your CSCS, you have a lot more knowledge than I would say I do about it. But I'm a big proponent of creatine. Huge proponent of creatine, especially if it's is it the most researched supplement as of now?
It is the most research evidence-based supplement when it comes to the efficacy of the supplement, of what it does. It's even there's some great research about how it supports cognition in Alzheimer's patients. It supports just generalized more ATP production. I think I said ATP last episode. ATP is like our body's natural currency. It's how we get and recycle energy. So my recommendation for all athletes and pickleball players to increase your power production, increase your force production, and increase your overall reaction time as well, because you're getting all the cognition benefits, is to take at least 5 grams a day. That's what you take, right?
Yeah, 5 grams a day.
Yeah, 5 grams a day.
Also, too, I don't think a lot of people know about the red light therapy. If you want to kind of talk about that a little bit.
Yeah, so red light therapy has a lot of mixed evidence about it. It feels good to me. It feels
all
good.
in all, is it supposed to be kind of like utilizing it for anti-inflammatory purposes?
Yeah, you can definitely modulate inflammation with red light therapy. There have been studies to show that you can help increase collagen production, mostly in the skin, but you can get down to some of the deeper levels. But it's really heating up the tissue. It feels good, but their evidence is mixed on it. It looks cool.
Yeah,
it looks cool. But I like to use red light therapy instead of ice, because ice is good within context, but people are always icing too much, in my opinion, especially once the injury becomes chronic.
You want the blood flow
at the end of the day. Yeah, the ice age is over. The ice age is over. I'll repeat that.
There's a lot of controversy, but
Let's go into the Rice method. So the generalized school of thought when it comes to when you sprain your ankle, when you have an injury, you do Rice. You rest it, you ice it, you compress it, you elevate it. The founder of the Rice method, don't know his name, but I read this today. The founder of the Rice method recently came out around 6 years ago. Says we probably shouldn't be doing this. And everybody's still doing it. Even the physicians are saying, oh, yeah, you need to, when you have an injury, immediately ice it. Think about it like this. All right, there's a wreck on the road, right? And your car breaks down. You're in bad shape. Why would you want to put a roadblock where the police officers and ambulance are trying to come in there?
But that's what so the more I thought about this, right, especially after taking the dry needling course, right, you get a good pretty much twitch response. You're creating down regulation of spontaneous electrical activity, a lot of gate control theory stuff. But, they teach you taut bands, tight tissue. Typically, ischemia occurs, right? And so when you think about a more like tendinosis, tendinopathy, a lot of times you'll probably see, I'm sure, like the collagen fibers are more like a spaghetti plate,
like misaligned.
Right? Misaligned. They're not in this nice parallel fashion anymore, right? And so that in conjunction with ischemia that's probably occurring throughout the whole area, it's like you want that blood flow to supply good oxygen and nutrients for the area.
100%.
So I think, I don't know, there's a lot of misconception between ice and heat right now. I get a lot of patients that say, I feel like I should ice it, but I always have to tell them, look, icing is probably a bad thing for you right now. Now, if something was more acute, let's say you just fell, sprained your ankle or something like that, a lot of swelling going on, ice is good.
It has its context.
It has its context.
Post-op too, right?
Post-op too.
Post-op's when I'll actually will utilize ice because, yes, range of like swelling can limit your range of motion and it can compress on the free nerve endings, causing a lot of pain.
The pain, yep.
Ice is for pain. Ice is going to reduce swelling. Ice will not evacuate swelling. There's a difference. Reduction and evacuation is a big difference. To evacuate the swelling, you have to utilize your lymphatic system. And how do we utilize our lymphatic system? You got to fucking move. You got to move.
Yeah.
So, like, my recommendation, if you sprain your ankle or you tweak something, low grade activity, ankle ABCs, elevation, that's still a big thing. But when you ice something, you are slowing down the healing process. In most cases, there's some context there. But when you ice something, you are literally slowing down the healing process. You're blocking white blood cell production. You're blocking insulin growth factor 1, and you're blocking growth hormone. And you're decreasing capillary permeability. Why would you want to shut down a natural mechanism that we were designed to heal, to express? Yeah. So inflammation is there for a reason. Don't shut it down. Be mindful of it. Use it. Try to modulate it. That's my school of thought.
I have a question for you. Ice baths, right? Would you recommend that? Let's say you have a pro pickleball athlete that's doing a match each day in a tournament, and they have to have their body ready for the next day to be able to perform optimally.
Yes.
Right? Would you say that would be when ice bath or using an ice bath is necessary?
Context.
Okay. Yeah, because I do know that there's times where you shouldn't,
yes.
right? So if you could kind of like distinguish between, all right, when would be the right time to utilize an ice bath? Because I know that's a big thing right now.
For sure. And that's a really good question. Let's delve into it for a second because this is important. So when it comes to ice baths, if you're going to do it before your activity. Because when you do, say a resistance training is a great example. So say if you resistance train, what's happening, Doc? You're creating inflammation, right? You're breaking down muscle fibers.
Yep.
If you same thing with like icing after a workout. So if you resistance train and then you go take an ice bath, you are diminishing muscle protein synthesis by a lot.
Right.
Muscle protein synthesis is muscle growth. So if I was to say do it on your rest days. So try to not do any form of resistance training in conjunction with ice baths. You're going to, I wouldn't say, but you're going to make a notable difference in your tissues and muscles' ability to regenerate, grow, and make those positive adaptations. When it comes to pickleball, though, context here, right? Context is important. It feels good. It gets your inflammation. It reduces some of your inflammation, absolutely. And then it helps DOMS, delayed onset muscle soreness. It does help that for sure. But if you're if you're in the off season, and you're trying to make those positive adaptations and, really get in the weight room and get into the performance side of things, utilize that. But timing is important. Making sure that you're doing it before, because you actually get a little test boost. You get a little testosterone boost in some studies.
Gotcha.
Then as opposed to doing afterwards. Back in the day, all the players were doing afterwards. They didn't know. It felt good.
Yeah.
Feels good. Yeah. We got a cold plunge downstairs. I think you can do a subscription fee for like, what, $25 a month for it?
25 a month.
Try it out. It feels good. Absolutely. I use it a lot, but context is important. Just don't do it cussed. Be mindful of what you're doing. Be mindful of why you're doing it. But yeah, man, that's recovery is important. So just to kind of sum that up, ice is good in context, but you always want to opt for an active recovery. You want to move your body. Yoga is great. Stretching, active stretching, dynamic mobilizations, red light therapy can be good. And then making sure that you're just keeping your stress down. Calories, protein, super important. If we're talking with your protein goal, Jeff, what are you trying to do?
Just a little bit over body weight.
Yeah, a little bit over
body weight. I'm about 138, 140. So I try to hit 140 a day. Now, I mean, I don't keep track of it on like MyFitnessPal or anything like that, but I just can I know a pound of ground beef is going to be like 100 grams of protein. So I just go based off things like that.
Now, if you're obese and you're like 600-pound fucker, don't go eat like 600 pounds of protein, like 600 grams of protein. That would be insane. So let me rephrase that. So when you're shooting for your protein goal, say you are a little bit overweight. Say you're, I don't know, Mississippi. We're honestly,
let's say 280, 300.
280, 300.
Yeah.
You want to make sure that you're eating your goal weight in grams. So say if you're 280, you want to weigh 200 pounds, go for 200.
Okay, so if I wanted to gain weight, like gain some muscle mass, and I want it to be like 155, I should shoot for 155.
100%. At least your current weight. But yeah, you want to shoot for your goal weight.
Gotcha. Would you say current weight would be like a maintenance sort of amount of protein?
Yeah, all the studies show that the optimal dose is 0.8 grams to 1 gram.
I see. Okay.
Yeah, per pound of body weight. Some of the literature will say like you want to shoot for like 1.8 to 2.7 per kilogram of body weight. But to make it easy, figure out your goal body weight and try to eat that in protein every day. And that's huge for recovery. Protein's so underrated. Everybody's always if it's not sexy nowadays, it doesn't sell.
Well, my thing. So when I went on this whole stint of like throughout college, undergrad, trying to gain weight and gain muscle mass. Like if I hit my protein goal, I was okay, and I saw everything just kind of skyrocket after that. Like if I was hitting my protein, I was moving in the right direction. And I thought that was really interesting. Like, that was an interesting observation on my end. So it kind of just told me like, hey, look, protein's important. Like protein is really, really important.
Yeah, this is going to be a big important point right here as well. I believe that protein is the most important macronutrient for humans. They're all important. Carbs, fats, proteins,
but you need
everything.
But proteins to make everything and synthesize.
Exactly.
Yeah.
Protein, you're giving your body the raw materials it needs to heal and recover. So if you're taking that away, say, I mean, I'm not like dogging vegans or anything, but you're having a huge limiting impact on your tissue's capacity to heal and get back on the core field. Yeah. So protein is huge. We are designed to intake it like incisors. It's like eat, get your protein in. You know what I'm saying? Like, you know, you can, if you're a vegan, you can opt for like a pea protein. It just tastes like shit though.
Yeah.
Like,
I've tried some vegan protein. It's ass.
Yeah, for sure. But if you are vegan, like B12 for sure, that's going to be huge. Creatine, that's going to definitely help you. But when you take away animal sources, you're eliminating all your B vitamins, which is what gives you energy.
Yeah.
Your hormone profile is super important.
Yeah.
So protein is, I think it's one of the most underrated but most important macronutrients there is, and we need to emphasize that for recovery. Huge.
Did I tell you I tried a carnivore diet for a little bit?
Yeah. Did you find success with it?
Dude, so much energy. It was weird to me. Like, because in the morning I would just make sure I ate eggs and some sort of meat, and I would the way I'd put it is I had sustained energy. I didn't have those slumps. Yeah, those crashes throughout the day. But
I think when you can modulate insulin, so when you like have a blood sugar rise, insulin's got to turn on, and you just get this crash, right?
Got to come down.
So if you can just keep insulin steady, I think your energy is going to be steady.
Yeah.
So I think carnivore could be used as a tool, but how long could you Could you do it the rest of your life, you think?
Ooh.
No way, bro.
I love
no
carbs.
Way.
I love
It's
carbs
great.
too much.
And
Yeah.
carbs are great in context. Like if I'm about to go compete in a singles pickleball tournament,
Rice Krispie treats.
bro, load
Yeah.
me up for sure. Yeah, that's gonna give you the extra spunk. So like, yeah, it can be like I always like to like speak in terms of context because you just can't say this is bad, this is good, this is the best.
Sure.
This never happens.
Yeah.
Context is super important. Experts never say always best. Never. Everything is nuanced. So you have to be mindful of like how to use those terms, especially as professionals with us. Like the other day, John was working with a wheelchair rep, and he had to say, "Well, I'm the best in the business." Like in front of the patient, in front of him, and he was just kind of like, "Well, if you have to say you're the best, are you really the best?"
Yeah. Yeah.
So I feel like being humble and always being an open mind, like open learner, having an open mind is super important. I feel like with Neolife, we value ourselves on being open. Lifelong learners. We are lifelong learners. If you say you've learned everything, that's not the way to go.
There's still so much to learn.
That's not the way to go. You can always learn something. You can always grow. This is kind of how I used to love Pokemon, right? And I was like, I'm going to level up Squirtle. I'm going to level up and give him to Blastoise. That's how I treat my life. I treat my life like a video game. I'm probably like a war turtle right now. The second phase, that's kind of like what I feel like I'm at, but I can always get more, you know what I'm saying?
Yeah.
So it's like I never say, okay, this is it. We have our doctorates. We're just getting started.
Yeah.
We're just getting started. So if you say that you've learned everything and that you're the best, you're this, that, you're putting a limiter on yourself. Yeah.
You don't know how far you'd be able to take yourself.
In order to expand, you got to take the governor off.
Yeah.
You got to be open-minded to continuous learning, even with pickleball. I'm sure the best players in the world, Ben Johns,
They're still learning every day.
They're still learning every day. Roger Federer, when he was in his prime, Rafael Nadal, when he was in his prime, those tennis guys, they were always trying to learn, from people who were older than them, from people who had, experienced, wins, losses, and everything. So it's important that we express to everybody that you need to have an open mind and you have to have the capacity and willingness and want to learn and to continue to grow. And that's just everything. You know what I'm saying, bro?
Yeah. I think that's a good way to end it right there.
That's a good way to end it, man.
Yeah, that was awesome.
Episode 3 coming soon. We're going to keep this up every week. But yeah, you guys chime in, communicate with us.
Yeah. We're always by our phones, like TikTok, Instagram. Do we have the Facebook page?
We have a Facebook page, yes, sir.
Okay, so Facebook as well.
YouTube channel on the way.
YouTube channel with the podcast on the way. For those of you that want to watch the full podcast and just, continue to support us. But we're here. We're responding. We don't have like a massive following. So, but also too, like I want this page to be a very personable page as well.
100%.
And I want those of you that are along this journey with us to know that we're here. And, just because you reach out doesn't mean that we're not going to reach back out to you. Like we're here to be a resource for you guys.
And engage.
Always. Yeah.
Engagement.
And engaged. Yep.
Yeah. Jeff summed it up. We are here to help. We're here to assist.
Yep. All right.
Good episode, fellas.
Solid. Nice.
Stay tuned for the next one.